In infants, sometimes we find that after the delivery, the infant does have difficulty turning the head to one side, or the head may actually be maybe prefer to be kind of twisted and rotated, and may have difficulty moving outside of that condition. Again, many different things can cause this. It is difficult to pinpoint without knowing exactly what happened in the delivery. Certainly, sometimes we can have a challenging delivery. We can have some injuries to the collarbone, etc., which may contribute to this. Some stretching of different nerves could contribute to this. But I've also seen many cases where it just seems to, there is no explanation for why we have this preference in how the child likes to rest their head. Now, this can be due to the fact that we tend to lay infants on their back to reduce the SIDS risk, and some theories seem to think that this could contribute to the infant preferring to turn their head to one direction. So one thing we can do is certainly try to have things on the other side of the infant to make them want to look. You know, put their stuffed animals or have mom be on the other side to encourage them to look in the direction they don't like to look. But osteopathic manipulation, I've had a lot of success treating infants with torticollis, because sometimes what happens is that during the birth process, or depending upon how the child is positioned in utero, we can find that there's some compression back in the occiput, which is the bone at the very, very back of your head. And a lot of important nerves come from the area that's around this bone, including some of the nerves that go to actually help contribute to rotating and turning the head. So what we find is that oftentimes in the occiput, we find that some of those bones are compressed because those bones, they haven't fused yet. The infant skull is very pliable to facilitate delivery. And so what we find is that some of these pieces of the bones are compressed. Well, the nerves have to travel through those compressed tissues. So sometimes those nerves are being compressed on. That's what's irritating the nerves. That's what's causing that muscle to be stimulated and contributing to the torticollis. The osteopathic manipulation for infants is usually extremely well tolerated. Most infants fall asleep. If the child is really anxious, oftentimes all it takes is to allow the infant to feed during the treatment, and they relax and fall asleep during treatment. And this treatment we can actually get on the bones on the back of the head, and actually with just very gentle traction, just gently help open the space between those bones. That decompresses those nerves and oftentimes will allow those nerves to relax and will allow the muscles to relax. So infant torticollis can be something that can oftentimes be helped very, very easily with osteopathic manipulation, and if it's persistent, we'll oftentimes add some infant-like occupational or physical therapy that will also help with develop the head movements, and also again putting toys or other objects where the infant has to look in the area that they don't prefer to help encourage the development of that range of motion. But most kids respond very well, but again have had great success using osteopathic manipulation, so I encourage you to seek that out if your baby's suffering from torticollis.